Shoulder instability is a really common problem, particularly in contact or collision athletes. So when the shoulder dislocates, often the labrum and stabilizing ligaments in the shoulders tear. Most commonly, we can repair these tears arthroscopically, but in some cases, either when there's a significant amount of bone loss or in an athlete or person who's had a recurrent dislocation afterwards, an open surgery called a Latarjet procedure is indicated. This is an interest of mine. I've actually done some live Latarjet surgery demos for athletic trainers conferences, which is always kind of interesting, but lots of fun for them to kind of see the anatomy up close, and kind of fun for me to do something in a different environment. But shoulder instability it can be a very complicated problem, but there's some really good solutions for handling it. And so sometimes people aren't sure if the arthroscopic approach or the Latarjet is the best option, and often we can talk through that in the office and come up with an individualized treatment plan that's best for you.